Hello and welcome. My name is Dr. Suhail Qureshi and I am a senior consultant in medical oncology at Fortis Hospital, Shalimar Bagh. Today we are going to discuss a very important topic जिसके बारे में आम तौर पर उतनी चर्चा नहीं होती है और वो है sexual activity for patients of cancer during chemotherapy. ये एक ऐसा टॉपिक है जिसके बारे में हमारे बहुत सारे यंग कैंसर पेशेंट्स के मन में कई सारे सवाल, कई सारे संदेह और कई सारी बातें उभरती हैं, पर शायद वो कई बार इन बातों को डिस्कस नहीं कर पाते या उसको डिस्कस करने में एक शर्म से महसूस करते हैं। पर ये एक बहुत इम्पॉर्टेंट टॉपिक है और ये एक कैंसर पेशेंट्स के या किसी भी इंसान की लाइफ का एक इंटीग्रल हिस्सा है। सो व्हाई इज इट इम्पॉर्टेंट? Well, sexual activity is an important part of overall well-being of any individual, even so for cancer patients who are young. Not only is it an important part of your overall physical, mental, as well as emotional well-being, but it also gives a sense of confidence to your partner when you are intimate and when you are in a relationship. And therefore, it is important कि इसके बारे में कुछ अवधारणाओं को बदला जाए, कुछ मिथ्स और मिसकंसेप्शंस को अलग किया जाए और आपको एक जेन्युइन इंफॉर्मेशन दी जाए। सबसे पहले इंपॉर्टेंट बात जो पेशेंट अक्सर हमसे पूछते हैं वो ये है कि कैंसर कंटेजियस नहीं है, कैंसर कम्युनिकेबल डिजीज नहीं है, तो अपने पार्टनर के पास आने से, उनके साथ सेक्सुअल एक्टिविटी में इंडल्ज करने से या उनके साथ किसी भी तरीके के एक अफेक्शनेट बॉन्ड को फिजिकली एक्सप्रेस करने से कैंसर एक दूसरे को नहीं फैलता। इसलिए सेक्सुअल एक्टिविटी इस दौरान, कैंसर ट्रीटमेंट के दौरान, इज़ नॉट अ बार, आप उसके लिए कोई कंप्लीट नो नहीं है। लेकिन इन्फेक्शन पॉइंट ऑफ व्यू से भले ही इस चीज़ के लिए हम मना ना करें कि ये एक इन्फेक्शियस डिजीज़ नहीं है, पर कुछ एक ऐसे इंपॉर्टेंट पॉइंट्स हैं जिनका हमें ध्यान रखना बहुत ज़रूरी है। फर्स्ट एंड फॉरमोस्ट, जैसा कि किसी के लिए भी ज़रूरी है, सेक्सुअल एक्टिविटी में दोनों पार्टनर्स का इन्वॉल्वमेंट एक इम्पॉर्टेंट बात है एंड देयरफॉर यू कैन नॉट फोर्स और प्रेशराइज योर पार्टनर फॉर इट। यू कैन इंडल्ज इन सेक्सुअल एक्टिविटी ड्यूरिंग योर ट्रीटमेंट फॉर कैंसर only when you are emotionally and psychologically up for it and you are actually feeling up to the mark to indulge in those activities. In general, it is okay to have sexual relations while undergoing chemo as long as your own emotional well-being and your own emotional feelings are actually involved in that particular activity. There are certain important points that one must keep in mind. First important point is, what type of cancer do you have? So for many patients who have cancer of the genitourinary tract or cancer of the anus or the rectum, cancer of the uterus or the ovaries, it's important that you discuss with your doctor whether you are allowed to indulge in sexual activity while undergoing treatment for that particular cancer. Because during the time that you have undergone radiation therapy or undergoing chemotherapy or any particular invasive procedure like a colonoscopy or a cystoscopy to look inside the urinary bladder or any scopy which has resulted in any instrument going inside your bodily organs, during that time the doctor may tell you to avoid indulging in sexual activity, and therefore special precaution needs to be taken before performing sexual intercourse during these times when you are undergoing radiation therapy of that area or have undergone an instrumentation of that area or there is any particular wound or any particular abrasion as a result of any procedure in that area, and therefore one needs to be careful. Secondly, the type of chemo that one is undergoing is also very important before you indulge in sexual activity. There are certain chemotherapy drugs जिनसे कि आपकी WBC काउंट और आपका TLC या प्लेटलेट काउंट गिरता है. During this period, it is not advisable to undergo or perform sexual activity simply for the reason that जब आपकी immunity कम होगी, at that time, introduction of any bacteria or virus during sexual intercourse can be detrimental to your health, क्योंकि उस टाइम पर आपकी immunity low है, and therefore any bacteria or virus that may get introduced in your body as a result of sexual intercourse can cause problems for you, and that can be sometimes difficult to handle. Similarly, बहुत सारी कीमोथेरेपी ड्रग से हमारी प्लेटलेट काउंट गिरता है, एंड देयरफॉर जिस दौरान हमारी प्लेटलेट काउंट कम है, वी शुड अवॉइड इंटरकोर्स टिल आवर प्लेटलेट काउंट हैज रिजन टू सेफ लेवल्स, बिकॉज ड्यूरिंग दैट एक्टिविटी there is an increased heightened risk of bleeding from the genital area if sexual activity is performed. Third and very important point that must be kept in mind, is pregnancy possible, and whether at all during chemotherapy or during cancer treatment can one get pregnant? Well, technically yes, it is possible for someone to get pregnant during chemotherapy or cancer, but it is not advisable and strongly discouraged for someone to get pregnant while the person is on chemotherapy. The reason is that many of these chemotherapy drugs are secreted in our bodily fluids, and the quality of your sperm or your ovum can be affected by the chemotherapy drugs. Not only that, if someone happens to get pregnant during chemotherapy, then the detrimental effects of chemotherapy on the developing fetus can result in birth defects and congenital abnormalities and mutations in the baby that may not be healthy for the developing baby, and therefore the ill effects of chemotherapy on the baby can be too much for you to handle. As a result, it is very strongly advised that if at all you are on chemotherapy and indulging in sexual activity, then it is advisable that you use a very reliable birth control measure with advice from your gynecologist or your oncologist. These are only broad guidelines that we can give for all those young patients out there who have these questions in mind. If at all you have any more questions regarding such issues, please give us your comments and we'll get back to you. एक बात याद रखें, sexual activity is not the only way to express your love or affection to your partner. In these difficult times, just holding their hands, cuddling, spending time with each other, and just physical proximity to your partner goes a long way in establishing trust and confidence. Thank you so much.